evening, WUFO radio audience, and welcome to another edition of the Great Lakes Health Radio program. I'm your host this morning, Francesca Messiah from Kaleida Health. And our topic for today is nutrition. We can never hear enough about nutrition and trying to understand how nutrition really works in our body. What's good nutrition versus a bad nutrition or not as healthy nutrition, and nutrition for different ages. We have a lot of different age groups listening to our program, and how to get the correct amount of nutrition. Well, anyway, our guests for today are Barbara Sylvester, dietitian and certified diabetes educator. Good morning, Barbara.
Good morning.
And our other guest today is Katie, and Katie is a registered dietitian. Good morning.
Good morning.
Katie Manis.
Yes.
Yes. Good morning.
Good morning.
Yes. Well, let's start our conversation. Please describe how your department, nutrition, interacts with Kaleida Health and the physicians.
Katie?
Well, our department works first by consults, so we have screening criteria to identify people at risk, nutritional risk in the hospital, and based upon that, as well as consults from physicians and other providers, we would see our patients. Most of the patients we see in the hospital, our goal is to give them education on their diet so that we can prevent them from having to come back to the hospital, so they can be healthier at home and live higher quality life there as well.
Now, when you talk about patients in the hospital, are they outpatients, like who are just coming to visit one of the physicians in the office, or are they patients who have stayed at the hospital over a 24-hour period?
Both.
Mm-hmm.
So, Katie works a lot with the inpatients. I work a lot with the outpatients.
Mm-hmm.
So all the inpatients will get seen. Katie knows the criteria better over a certain amount of time. If for some reason a patient or one of your listeners was in Buffalo General Hospital and they didn't get, a lot of people are sick at the time and they're not sleeping and they don't feel well, so they don't get a full nutrition education.
Yes.
If they feel they got discharged and then they're having questions about kidney disease or their diabetes or their condition, they always can come in for a free nutritional consult at Kaleida.
Well, and you know, what I enjoy doing in the show is giving the phone number. So if someone has a question, and we're going to repeat the phone number several times throughout the program, if you could repeat it slowly and twice.
859-2821. That's our diet office. It's our voicemail, and you can always leave a message for nutrition counseling.
And one more time, please.
859-2821.
Okay, thank you. And I had someone recently ask me a question. They were probably around, I don't know, I'm going to take a guess, age 70. And their question was, in terms of breakfast, because most people are now having breakfast, are there different nutritional food items that if someone is 16 that they should eat, or versus if someone is 70 years of age, what they should have for breakfast, or are all breakfasts do they all look the same?
Well, I think it's generally good healthy eating, whether you're 17 or you're 60 or 70. Probably the biggest difference is going to be the quantity of food.
Yes, and if you could talk about the quantity.
Well, a 60-year-old or 70-year-old is going to most likely need less calories than a 17-year-old or a 12-year-old or even a 22-year-old, and your activity level has a lot to do with it too. But portion control is the number one thing for good healthy eating. So if you're trying to lose weight, and you're not sure all about, carbohydrates or fats or proteins, the main thing is to just cut your quantities back that you're eating.
Okay, so when we talk about, like, a lot of people like eggs.
Mm-hmm.
So, like, how many eggs, how should it be prepared? Let's just start with that.
Mm-hmm.
Or should it be egg whites, egg yolk? So how would...
No, it doesn't have to be the egg whites. That's changed a lot over the years. Eggs generally are fairly healthy. Again, it's the quantity. So even if you have heart disease, it's 7 eggs a week now. Or before, I think it was 2 eggs, and it's not so much...
so that's almost, if you're having breakfast and you have 2 eggs out, you should maybe consider putting 1 egg away. If you said
you
7 eggs,
2 eggs.
but
Well,
only
unless
7
you
a
eat
week.
eggs every day.
Right.
And if
You said
everybody
7
does.
eggs a week, so
Right.
I mean, I'm just giving an example if someone's
Yeah,
listening.
actually, people don't realize in the yolk is where a lot of the nutrition is. That's where all your vitamins are. The B vitamins, the D, A, E, the lutein, your antioxidants. They're mostly in the yolk. The white is the protein.
Oh, so even if it's a hard-boiled egg, it doesn't matter how it's prepared. It's still the same. That
Yeah, you might lose some of the nutrients by cooking it for so
Okay.
long, but it's still going to be a good healthy snack. It's
Oh.
nice because eggs are already portioned down into 1 ounce servings. So, you know,
Okay.
that egg is 1 ounce generally if it's an average size egg.
Okay, so go ahead.
The problem can be, though, is the way that you prepare them. If you're preparing it, you're frying it in a lot of oil, then that takes a very healthy food and makes it not so healthy. And so hard-boiled is a great way to do it, or with a small little bit of olive oil if you're going to fry it, or scramble it with some skim milk in it.
How about Pam, or not Pam, any of the spray oil?
The spray oil works perfect as well. That's even better.
Or poaching them.
Mhm.
And nowadays with the nonstick skillets, you really don't need
You don't need
a
as
large
much
quantity
as you
of.
think.
How about, okay, so they have the egg. How about white bread versus like a whole wheat bread that says
Mhm.
with whole wheat ingredients on the label, not a brown bread with molasses? So
Right.
is a white bread healthy? I mean, any healthy or I'm just I'm just trying to
Right.
have a breakfast. So I'm just thinking.
Yeah, there's so many varieties out there.
So for the most part, the whole wheat bread is healthier. The one exception is with people who have a lot of kidney disease.
Oh.
But if you don't have any kidney disease, definitely the whole wheat bread is better. When you look at the food label, a slice of bread should have 2 grams of fiber or more per slice, then you know it's a good whole wheat bread.
Say that again.
A slice of whole wheat bread should have 2 grams of fiber or more per slice. That's a good, true whole wheat bread.
Oh, good. Oh, I didn't-
because a lot of they could put whole wheat on the food label. Actually, I've seen breads that say 12 seeds, 7 grain. You name it. You think it's the best bread, and the fibergram said less than 1. So the advertising is very misleading. You have to check the food label.
You have to turn that over, and sometimes it might mean bringing your reading glasses, or
Yeah.
I think they have I've seen magnifying strips that come in a little case, because I know a lot of times it's difficult to read the back of that
Right.
food label,
Mhm.
the
It's small.
back of the label. Okay, so moving on. Well, I'm going to talk a little bit more about that. Now, how about protein? I know a lot of people like a lot of menus. They'll have like a 12-ounce porterhouse or 8-ounce. They'll ask. I don't but in terms of protein, what's a good protein size if someone is trying to change their nutrition for the new year?
I would say it depends on the meat, because some meats are 100 calories an ounce, some are 30 calories an ounce. So the leaner meats, definitely the better, like chicken, fish.
So what's 100 calories an ounce? What kind? I'm just curious.
Ribs, sausages, hot dogs,
Rib sausages and hot
anything deep
dogs?
fried, chicken wings, fish fries, all that's gonna shoot the calories really high. So if you're having something that's really fatty, definitely a smaller portion, where if you're having baked fish or broiled fish, 5 or 6 ounces is fine.
Well, ribs, I think a lot of our members really enjoy ribs. So like 2 ribs would be average, or?
Well, it depends on the size.
It depends on the size. Okay. But I never thought about that with ribs.
Yeah,
Okay.
the ribs are pretty high fat.
Oh, yeah, that's okay. Fruits. So, you hear about fruits, and some fruits have more sugar. And if someone again is looking to lose weight and reduce, how would you look at what kind of
fruits? do you have?
what to avoid? And then we'll move on to another topic.
Okay. Yeah, the fruits, that's a big misconception for people, because they think fruit is so healthy and wonderful, especially the juice, and they drink a lot of it,
The
which
juice,
is a
yeah.
lot of sugar calories.
Mm-hmm.
Fresh fruit is always a better choice, and berries tend to be lower in fruit sugar than bananas, pears, grapes. They tend to be much higher.
And-
So smaller quantities of fruit is probably a good idea if you're trying to lose weight.
And frozen fruit is good. Is that if you can't?
Frozen food is great, and fresh fruit is great. The problem when you run into canned is that when you get it in the heavy syrup, so you always want to be sure you buy it packed in water or packed in, they make them with Splenda now, because those syrups really add in a lot of calories. But the frozen and the fresh are excellent sources.
No, okay. Well, thank you. I mean, I guess I'll move on from there. Now, you hear a lot about a good fat versus a bad fat. Like this fat is good for you. They say avocado fat is good for you versus, we'll go back to ribs or French fries are bad. Could you describe for our listening audience, like what does that mean when people are talking about that?
So I usually, the key and easiest way for me to differentiate it is if you think about if the fat is solid at room temperature or liquid at room temperature.
Okay.
So fat on a rib is solid at room temperature versus olive oil, which is liquid. So if you think about that, that's the way the fat exists essentially in your body. So you would want it to be more liquid. Generally, the fats that are liquid at room temperature are going to not cause as much harm in your body and decrease the atherosclerosis in your arteries, decrease that buildup that causes heart attacks.
And then the trans fats. Also, that's kind of a processed fat. It's those hydrogenated oils.
Yes.
Yeah, those aren't very healthy either. So if you go out to a restaurant, and even if they say it's vegetable oil, they're deep frying they heat it to such a high temperature and the oil is not clean, it's actually very high in the trans fats.
So that too is.
So deep frying at a restaurant, you're going to get a lot of trans fats.
Trans fats are a man-made fat. They're not naturally existing.
No, so I was going to say, so I know that vegetables are good for you. Fresh vegetables are good for you. But what you're saying is if you, like I know, I just think of different, sometimes at the fair they'll probably have fried Brussels sprouts this year. So you're saying that even if it's with a vegetable, you should stick to the vegetable, the vegetable that's purest form, not the fried coated spinach or something.
Right.
Okay.
Yeah.
The less processing, the better.
Right, exactly.
Less processing, the better. I like that. Yeah. Okay. Well, that's good. And now there are a lot of times on labels, they'll have low fat, reduced fat, and again, I'm just going step by step in terms of what's the lowest. Like what is if something says low fat, like should I as a consumer turn it over to see if it really is? I mean, is that label being truthful, or should I turn it over and again and read that label? Pull out my reading glasses.
I would definitely look at the food label, because the food industry is a multi-billion-dollar industry, so that advertisement on there, they spent millions of dollars to draw your attention in to buy that food. And it's not always what you think it is. So you always have to check the food label. The problem when you get into sugar-free, fat-free, all those different processed foods, fat-free, they tend to add more sugar, which is the carbohydrate. So you have to keep that in mind. If you're trying to lose weight or you have diabetes and you're watching your carbohydrates, a lot of those fat-free foods are higher. So I'm a big proponent of the real natural food, just watching the quantity of it that you're eating.
So the way our grandparents and great-grandparents used to prepare the food.
Yeah,
real
food.
Real food. A question. I was recently reading on a label. It said sugar alcohol on a label on the back. What's sugar alcohol on it? It was like, I don't know. It had nothing to do with alcohol. The product that I was looking. I don't know. It was a yogurt or something. But I'm like, okay, what is it? It appeared to be a new ingredient.
They've been out there for a while. The sugar alcohols. It's kind of like an artificial sweetener.
It's another sugar?
Yeah, it is a type of sugar. You just digest it much slower. The problem with some sugar alcohols is it can have a laxative effect. So if people start eating a lot of sugar-free foods with sugar alcohols, that could be a side effect. It still does turn into glucose, to blood sugar. It just does it much slower.
So it might give you a laxative type of
a GI distress.
Oh, well, that would make sense. Okay, now fiber. I hear about, I was looking at something recently and it had like 6 grams of fiber, 8 grams, and I know fiber is good for you, and they make different products with the name fiber, and a lot of cereals have fiber, but I know and I'm sure many members of our listening audience aren't really quite sure what exactly is, what does fiber, how much fiber, how does it help the body? Does it help prevent kidney disease? Does it help prevent heart disease?
So fiber is very good for multiple reasons. One is that it fills you up, which is a great thing if you're looking towards weight loss. It helps keep you feel fuller for longer. And it's very good for your GI tract, your GI health, as well as
And GI is?
your gastrointestinal system.
Okay.
Exactly. So help keeping everything moving well and keeping everything healthy. It also affects the absorption of a lot of different things that we don't want absorbed. So if you eat a high fiber diet, it can affect some of the absorption of the fats that you're eating. The problem with the fiber, the most natural form of fiber is found in your fruits and your vegetables and your whole grains. When you're looking at foods that don't generally have fiber and are advertised as having fiber, that's generally added in by food companies, and that's not necessarily, it's not bad, but we would prefer for you to get it from natural sources, so those fruits and vegetables and whole grains.
So we're back again to the fresh or frozen fruits and vegetables. Great. And I say
Exactly.
fresh or frozen because right now it's winter time, but in another few months,
Right.
there's the farmers market.
Yeah, which are
that's
excellent.
across the street from ECMC. We work, part of the Great Lakes Health. So,
Yeah, beans
just a
are
few
really
months.
high too in fiber. Your kidney beans, garbanzo
Kidney
beans,
beans.
lentils, black eyed peas.
Just don't fry them or add different. How about refried beans? What are refried beans that are in tacos? Does that count?
Well, they tend to be higher in fat than some of the other sources of beans, so you do want to just be aware of that. So you would eat less of those than you would a natural occurring bean, but they do still have some of the health benefits of beans.
Okay. All right. Now, does poor nutrition cause high blood pressure?
Not necessarily.
Okay.
It can contribute to it, though.
Contribute. Okay.
Yes, yep. So the reason high blood pressure, your veins and arteries aren't expanding the way that they're supposed to. So that could be because of genetics. It could be because of a sensitivity to salt. It could be because of plaque in your arteries or blockages. There's a lot of different reasons. So the nutrition could definitely contribute to that. Generally, it's not the first end-all be-all cause, but the better you can eat, the more fiber you eat, the less salt you eat, the more potassium, the more fruits, the more vegetables. That can all help lower your blood pressure.
And weight loss too, I think, is key for your blood pressure. So if you're overweight and you have high blood pressure, sometimes just losing 5 pounds or 10 pounds makes a big improvement.
And eating the fresh fruits and vegetables and
Yeah, all those nutrients.
the 3 ounces of the 3 ounces of meat. Yeah, no, that's true. Now, salt. You talked about salt. Is there such a thing as good salt, and how much salt should? I mean, in an ideal world, for our listening audience, what's an ideal amount of salt, and what's the average amount of salt that people really do eat?
The recommended salt is usually like 2,300 milligrams or 2,400 milligrams a day.
And what does that look like?
That's a level teaspoon.
It's
One-
one level.
1 level teaspoon.
Measuring teaspoon.
Measuring teaspoon. I don't know if there's a difference in the measure.
Yeah, you wouldn't want to pull one out of your silverware drawer, like a tablespoon or teaspoons. They're different.
Okay, so one.
That's a measuring teaspoon.
Okay, so then I know a lot of people, a lot of meal plans and such call for. They always recommend frozen meals, and you see them, in any grocery store, all the grocery stores, and even the convenience stores now have frozen meals, and they'll say high fiber, low fat. But then when you turn over again the back and you read the label, some of them have like 400 or 500 milligrams of salt. So what you're saying, that's enough salt for a couple weeks in your system?
A meal.
400 and 500 milligrams is actually not too bad if you can find a frozen dinner that way. They generally tend to be very high in salt. The problem usually with salt is not how much we add to our food, but how much processed foods that you're eating. So the lower the salt, and on a food label, salt is written as sodium.
Sodium.
So sodium and salt are the same. Well, the sodium in salt is the problem. So you want that number to be as low as possible.
Are there any other words on the label that, in the ingredients that are other words for salt? I know sodium is that's right there, but I know that if you're reading, like, let's say, for instance, a frozen meal, and are there any other words that mean the same thing, that are code? I call them hidden code words.
They usually have sodium
Okay.
as one of the codes.
Yeah,
or the
usually
words.
sodium and salt are pretty well labeled.
Interchangeable, yeah.
Mm-hmm.
And pretty interchangeable.
Okay. Well, I'm going to have you give your phone number again in case one of our topics have triggered a thought. What's the number again?
To make an outpatient nutrition appointment,
Yes.
our phone number is 859-2821. That's 859-2821.
And I didn't mention where is your office located?
We actually have a new location. It's in the GVI, the Gates Vascular Institute, which is the brand new building next to Buffalo General, and we're on the second floor in the Wellness Center.
Okay. And I know there's valet parking and there's a parking lot across the street. And I know there are parking meters.
And there's bus routes.
There's bus routes.
Yep.
It's right there at the Allen stop. So I know it's pretty convenient, to get to. For an overweight person, and that can, it's kind of a relative term in terms of for an overweight person, someone who's either 100 pounds overweight or 20 pounds overweight, what are some of the most important steps that they could take today, being the day before Valentine's Day with the heart? I mean, I always think of the Cupid and the heart health. A heart is very important. What are some of the changes they could make today, the day before Valentine's Day, to get on a good foot to better nutrition?
Again, my number one thing is portion control.
Portion control.
Just watch the quantity of food you're eating and the less processed foods.
Okay.
The food label is one thing a lot of people, I find, read incorrectly.
Oh.
So whether they're looking at calories or they're looking at fat grams or they're looking at carbohydrates, which is the actual sugar content, that's one thing that I find very misleading on the label. A lot of people look at sugar grams. They need to look at the total carbohydrate.
And we didn't talk about carbohydrates.
Correct. But that is what obviously turns into glucose is the total carbohydrate. Because a lot of products will say sugar-free and have 0 grams of sugar, but have 30 or 40 grams of carbohydrates, which turns into sugar, glucose, blood sugar. So what people do is they just look at the calories. It might say 200 for this bag of chips. So they eat the chips, which is high calorie, high fat, and they think, oh, it's only 200 calories. But what they failed to look at was how many servings were in the container, which might be 3 or 4. So the numbers there on the food label are based on the quantity, the serving size. If there's 4 servings in the package, you multiply those calories or fat grams by 4. And sweetened beverages is another thing. Kool-Aids, fruit juices, Gatorades, energy drinks, pop, juice, just loaded in calories.
How about diet-free, sugar-free pop?
It is 0 calories, but then you're getting a lot of artificial sweeteners, so it's not something you want to hydrate yourself with. I would say water.
There's also some recent studies that have shown increase in cravings for sugar when you're drinking diet pop, and so we don't really know with 100% certainty what that does to us when we drink it. So it's okay for a treat on an occasion to have the diet pop, but for the most part, your beverages should try to be calorie free. We tend to drink a lot of calories that way. They don't fill us up, and they just unfortunately add pounds to our waistline, which is not good.
And one thing we're trying to say today, audience, is that if you want, if you're looking to make changes, we're not expecting, and none of us to go cold turkey,
Right.
and just stop everything. You really, ladies, you're saying that begin in moderation. I mean, is this how when you would counsel someone? Is that you start with the baby steps? correct?
Yeah, absolutely. We start with the basic nutrition facts, and we see what the person already knows about nutrition, and we'll work from there. So rarely does somebody have to totally eliminate, a food item for the rest of their life. It's quantity. It's definitely portion control. And there are ways you can prepare it better with the less fat and calories. And we can always modify any recipe.
Yes.
You can fit anything into your lifestyle. It's just a matter of the right portion and making sure that the food's prepared the proper way. Very rarely will we ask anyone to totally eliminate anything from their diet.
So if someone has a small white potato, just have a small white potato, but just try and, the butter and the sour cream, that's where the real calories are, not necessarily in the potato.
Well, the potato is pretty high calorie.
Oh, the potato is, okay.
Yeah.
But when you add butter, salt, cheese, bacon, all of those things to a potato, you take something that's reasonable and you make it very unreasonable. And so it's about making smart choices. If you add broccoli to it and smarter choices, you can make it healthier and low calorie as well.
Well, we only have a couple more minutes. I just want to ask I'm just saying, anything you would like to add? I know we're talking about good nutrition, controlling, and disease control. Some good nutrition, you'd say, can prevent heart disease. Would you say?
Absolutely. I think really nutrition is really key to your health. So I mean, people know that smoking is bad and drinking too much alcohol is bad, but they just don't think food has any effect on them. Of course, I think it's key.
And kidney disease.
Genetics are pretty tough, and there's not a lot we can do to beat genetics, but whether or not you smoke, whether or not you exercise, and what you eat are the few things that you can control, and those will make the biggest impact in your health.
So it can control, we said heart disease, it can control stroke, possible.
Definitely.
Kidney.
Definitely.
Diabetes.
We can't say enough about diabetes.
Right.
And then milk. I know that if people are lactose tolerant, sometimes you again your number one more time.
It's 859-2821.
And they are the experts. So they're the ones who can tell you. Katie and Barb, they're the ladies in the nutritional their department at Colida Health. They are certified dietitians and diabetes educators, and they can let you know about milk. About health, about if you're lactose tolerant, and they can help you with your nutritional needs. And if you have any questions, they are the experts, and they are the ones to call. Until next time, our host next week is Rita Hubbard Robertson from ECMC, and I just want to say thank you and God bless. Thank you, ladies.
Thank you.
Thank you.
You've been listening to the Great Lakes Health Radio Show. I'm your host, Rita Hubbard Robinson. Join us next week for another conversation about your health.